Good afternoon, friends. And at the outset, I sincerely thank Manoj and Chandak. Can you see my screen?
Yeah, we can see, sir.
Thank you. So, the topic for me is dressing material. At the outset, there are a few disclaimers. The photographs, I'll be showing photographs of the products, and they are only for illustrative purpose. I am certainly not promoting any product, and I have not received any remuneration either in cash or kind from any company. At the outset, I sincerely thank our DNB student, Dr. Rishabh Tripathi, for helping me. There are so many different wounds in orthopedics, and there are so many dressing materials. And we honestly often get confused as to when do we use what. So what is an ideal dressing material? It is said that the environment should be moist. Obviously, there should be a bacterial barrier. It should prevent loss of body fluids and body proteins. Should allow gaseous exchange, reduction of heat dispersion, and of course, easy to use and cost effective. These are always the ideal things. Now, how do you classify them? Conventionally, for ages, we have been using the gauze and different types of gauze. And of course, there are now different new dressing materials available. The conventional dressings can be absolutely dry dressing, or you can have wet to dry, you can have wet to moist, or you can impregnate that gauze with several ointments. So the gauze is our main workhorse. It is cheapest, very widely used, easily available, absorbs quite well, and has been used as a primary dressing, or of course, it is also used as a secondary dressing over other wound fillers or hydrogels. And it is said that with gauze, the infection rate is little higher as compared to other types of wound dressings. Now, the gauze is a woven fabric. It is woven as warp and weft. These double threads are wefts and the vertical ones are warps, which actually strengthen this gauze weaving gauze. And then we are often it is mentioned that it's a 12-ply gauze. What is a 12-ply gauze? They are essentially layers. So more the ply, more is the thick gauze, and then it absorbs better. A woven gauze obviously absorbs exudates and other fluids in the open fibers. And then there are different types of meshes. They can be either coarse mesh or a fine mesh. So this is a commonest gauze that we use, which is a coarse mesh, and it is used generally in debridement. While fine mesh gauze is essentially for packing or bandaging. Ideally, it is used to cover, say, donor site or skin grafts. We have been using Gamgee. You know why Gamgee is called Gamgee? Why Gamgee is called Gamgee? It was one of the first. Yeah. Rajiv is unmuted.
Yeah, I think there was a surgeon by the name Gamgee who first used it.
Correct. Absolutely right. So this was a surgical dressing invented by Dr. Joseph Gamgee way back in 1880. So 2 layers of gauze and cotton, and that was one of the major breakthroughs for the dressing purpose. And the infection rate has supposedly gone down. He had published it in Lancet in 1880, almost 140 years ago. Wet to dry dressing was often used. Obviously, these days it's hardly ever used. It is essentially to debride tissues, fill cavities, etc. It was often used for full thickness and open wounds. Wet to moist dressing needs repeated changes, and not very useful if the wound is exudative. So very often we use GAMG. Essentially, if the incision is big, you need some kind of support, and that is why one uses GAMG. Some commonly used ready-made dressings, for example, G-Dress, or there are several companies which produce this. So these are non-woven fabric, and they can be stretched in both the directions. And the wound pad, there's a wound pad, and then there is a acrylic adhesive. These are very commonly used ready-made dressings. So non-woven fabric is used in these ready-made dressings, and they are not woven fibers, but these fibers are bonded together, and you can have large sheets. Now these gauze pieces can often be impregnated into petroleum, iodine, antibacterial compounds, etc. They make them non-adhesives and supposedly decrease the chances of bacterial proliferation. For example, Jelonet, which is a paraffin gauze, I have tried to find out the cost of everything. So Jelonet costs approximately 80 rupees. Bactigras costs about 220 for a 10 size. Cuticell is another impregnated gauze that is freely available. So they don't stick to the wound, and it becomes easier to keep changing the wounds. We have extensively been using ointments like betadine or neosporin. Not that they actually prevent infection in a post-surgical wound, but very often they are used so that the gauze piece doesn't keep moving. But open wounds, these ointments are extensively used. An ointment which was often used in past when we were not very aggressive as far as surgeries were concerned, and especially before WAC came in, when we started excising the wounds, was a debridase ointment, which is a papain urea ointment, which is a good debribing agent. And the breakdown of skin and pus is removed with debridase. So ulcers, burns, bed sores, surgical wounds, etc. The debridase is often used. Costs about 170 rupees for a 15-gram tube. Silver sulfadizine was another ointment that is often used for burns. Burn mesh is a good wound contact layer. It prevents adhesions of the wound. For example, large wounds like this, especially when you are using WAC or even otherwise when you need to change the wound, burn mesh is a very good contact layer. Now we come to synthetic occlusive dressings. There's semi-permeable films. They can be hydrogel, hydrocolloid, foams, alginates, hydrofibers. Several types are available. Collagen dressings. So the commonly used are film dressings. They are impermeable to fluids and bacteria. They promote moist wound healing. They're non-absorbent and relatively expensive. So these transparent dressings are often used for surgical incision sites, on burns, ulcers, and commonly on IV sites, because you need to observe them regularly. So one of them is Tegaderm, which costs about 90 rupees for a 6 by 7 centimeter size. Offsite dressings, waterproof, are often used as post-surgical dressing, because patients can take bath on this. A good dressing post-op, also called Mepilex, is a self-adhesive absorbent dressing, and especially in exudative wounds, they can be used and can be kept for about 7 days. The water resistance, again, patients can take bath. Costs about 800 rupees per sheet. It also comes in with silver, Mepilex border AG, and often used for burns. Costs almost 1100 rupees for a 10 by 10 size. Now, is actually whether all these fancy dressings, is it really useful? There have been papers, which I'll quote, of course, later also, that the incidence of blisters with this dressing certainly goes down. Dressing changes are not so commonly required. So these, as well as whatever I am discussing later, are often used in joint replacement these days. Hydrogels, they contain high water content. They're starch compounds that are integrated to form foam or gel foam. They promote debridement of discharge and reduce pain. So hydrogel compounds are often used, cost about 400 rupees for a 10 by 10. They cannot be used with heavy exudates.
If I can ask plastic surgeon a simple question during.
Yeah.
Many times, many patients come where we are actually dressing them regularly, but they say once we stop dressing and kept the wound open, they healed better. Any reason for that?
Yeah, I was, in fact, in my talk, I was going to mention in the last slide about a story of whether we overdo certain things, whether we go overboard. Usually, a surgical wound closes, the epithelium closes off in about 48 hours time. So most of our hand sutured hand wounds, or we just keep them open in head neck, over the chest also, from head neck reconstruction. We keep them open from day one actually. But I suggest for the first 24 to 48 hours, keep a dressing. Rip it off, it will come off with that small crest of ooze that had occurred in the first 24 to 48 hours. And after that, the wound is actually not accessible to the exterior. It is sealed. You can keep it open.
Okay.
Keep it moist.
And what is the best dressing for a venous ulcer on leg? That also is a very treacherous problem.
Yeah, venous ulcer should be, the dressing should be kept moist. So I think
it should be moist. Okay. Agashe sir is back. I think we can continue with this. Yeah.
So these hydrochloride dressings are also useful. Almost 1300 rupees for 15 by 15 size. Many people have started advocating this for joint replacements. So these absorb water, form a gel which prevents infection. They are often used in burns, oozing wounds, necrotic wounds, pressure ulcers. They are very useful. Venous ulcers. They're self-adhesive, but then if the wound has lot of discharge, then they may not be very useful because they have limited absorption capacity. Alginates have hemostatic properties. They promote debridement of slough. They are highly absorbent and biodegradable, and they can absorb a lot of exudate. And they're really suitable for wet or cavity wounds. These are the type of alginate. Costs about 450 rupees for a 5 by 5 size. So that way a little expensive, just 5 centimeter by 5 centimeter, cost almost 450 rupees. There's some dressings called hydrofiber. They also absorb wound fluid, and therefore again, if there is a lot of exudate, these dressings can be used. Different types of foam dressings are available. They can be adhesive or non-adhesive. And whenever there are moderate or low exudate, these things can be used. They're a little expensive, varying between 750 to almost more than 1,000 rupees. One more type of foam dressings, silicone dressings. There's skin substitutes, which of course is in the field of plastic surgeon, so I will not discuss. Collagen is used as a essentially it is from bovines. These dressings comes in pads or gels or particles, and again it absorbs exudate and provides a moist environment. They cannot be used in infected or contaminated spaces, and there are some people who are sensitive to bovine material and therefore may produce allergy. And they are of course also known to have transient pain, bleeding, blistering, edema and erythema. It costs almost 800 to 1,300 rupees of for different sizes. Now there are a couple of articles, as I mentioned earlier, direct comparison between a conventional dressing and occlusive dressing. And as you can see here, occlusive dressings can hold a lot of exudate, and therefore less number of wound, rather dressing changes are needed. And there have been studies which have said that the acute prosthetic joint infection is significantly lower in aquagel group, almost 4 times lower as compared to standard wound dressings. And the authors went on to estimate the cost in case these aquagel dressings are used all over United States. So they say that if they are used in every hip and knee surgery, it would add $27 million. But that will be balanced if the incidence of PGI decreases, and they say that all over US, if they are used, there will be a significant saving as far as management of PGI cases are concerned. Another study, they have also said that blistering, etc., is much less as in these occlusive dressings which are recently introduced. So finally, there are top 10 tips for preventing orthopedic surgery related wound blisters. And of course, we always assess the wound. We prepare the wound well. One has to make the dressing choice depending on what kind of wound is there. There should be decent flexibility of the wound, especially when you are using it on the joint. So make sure that it is most appropriate for the wound that is under consideration. One has to balance permeability and absorbability of the selected material. It is better to avoid repeated dressing changes, otherwise chances of blisters are more. And when possible, you should be able to visualize the wound, and of course ask our plastic surgery friends if you are not very happy with the wound. Thank you, friends.